Welcome to Transitioning to Medicare Part 2. My name is Lois Romeo, and I'm a volunteer with the Carroll County Bureau of Aging and Disabilities. You're viewing this as a pre-recorded session, and so we just need you to understand we're not affiliated or sponsored by any advertisers. We get some funding through the federal government, but nothing through any independent groups. It is all free and confidential and unbiased. And so we do not promote or recommend any entities. So we're the SHIP office, State Health Insurance Assistance Program. That is local help with Medicare. Again, no cost to all Carroll County residents. It's confidential, it's unbiased. We are fully trained counselors, and we have to be tested on that training. There's one full-time employee, Kristen Harvey, and the rest of us are volunteers. We offer education, such as what we're doing right now. We can do one-on-one counseling, and that would be set up by appointment through Kristen. We can do a benefit program review. So that would be if you want to understand the benefits better, or things that we've talked about in this class explained more. We can do that. We can review if you have a retiree plan you're considering and trying to decide, do you want a Medigap versus the retiree plan? We can help you look at the two of those if you bring the information in about the retiree plan. We can also help you with application assistance. This would be applying for financial assistance typically. And we can also help you with any kind of problem resolution. As I said, this is available to all Carroll County residents, but it's a nationwide program. So if you have a neighbor or somebody that a relative that's in another county and would like to get in touch with our counterparts, this is the phone number where they can find them. So what are we going to talk about today? Again, this is part 2. We talked about enrollment and the basic parts of Medicare last week, but this week we're going to focus on the gaps in Medicare. So there are a lot of different ways you can supplement Medicare. Medigap coverage is one of those. Medicare Advantage Plans is another option. And then we have the Medicare savings programs we'll talk about, as well as we're going to cover healthcare fraud and abuse. So this is a refresh for anybody that has listened to part 1, but you can be on the left-hand side of this chart, or you can be on the right-hand side of this chart. If you're on the left-hand side of this chart, you're under Original Medicare. So Original Medicare, you can go to any doctor, any facility that treats Medicare patients, and that is almost all doctors. You can decide if you would like to pick up a Medigap, which again is just a financial vehicle to supplement the co-insurances and deductibles that you would face under Original Medicare. And then you would decide about drug coverage, and that would be a Part D prescription drug coverage. The parts that you're required to have under Original Medicare, if you don't want to pay a penalty, are Part A, B, and D. Medigaps are totally optional. So that's the left-hand side of this chart. We have a lot of people in Carroll County on that side of the chart because it can get you to a fairly predictable expense flow if you can afford a Medigap. On the other hand, reasons you might decide to go to the right-hand side of the chart, Medicare Advantage plans are more like what you had under employer. So they would be an HMO or a PPO. HMO is a health maintenance organization. If you go outside that network of doctors or facilities, you will pay all the costs. You have no coverage. If you go outside that coverage and you've picked a preferred provider organization, you will pay more than if you stay in the network, but you do have coverage outside of the network. So these are regionally based. They have a network of doctors and facilities. They will combine Part A and B, as well on most of them, Part D. You cannot cross over between the two of these. So if you're on a Medicare Advantage plan, you may not be sold a Part D prescription drug plan. You also may not be sold a Medicare Supplement or Medigap policy. So just at a high level again, Part A and B. A is hospital. You've been admitted to the hospital. Part B is going to be all other medical, your doctors, your labs, etc., except your drug coverage. Medigap is a financial vehicle, and prescription drug Part D is everything to do with your prescription drugs. So under original Medicare, so this is if you're on the left-hand side of that chart. For most people, that is premium free. If either you or your spouse worked at 40 quarters and paid into FICA, so essentially the equivalent of 10 years, then you do not pay a premium for Part A. If you were to be admitted to the hospital, you would be responsible for $1,676 if you have no secondary coverage. After that, you would have 60 days of hospital coverage. And if you need more than that in a benefit period, you actually need to start paying $419 per day for the next 30 days each day. And if you need it more than that, you're going to pay $838 per day. Those 60 days, the 91st through the 150th in a benefit period, are called lifetime reserve days. And once you've used them across your lifetime, they are gone. You no longer have them. If you've been admitted to the hospital for at least 3 full days before you would be, and not counting the day you got discharged, if you had to go to a rehab center, so a skilled nursing facility, then you would have 20 days of coverage with no coinsurance. And after that, you would be paying $209.50 per day for the next up to 80 days. This is per benefit period. A benefit period is defined by when you last got out of the hospital or that skilled nursing facility. If 60 calendar days have gone in between that and the next time you go into a hospital, then you are in a new benefit period. And what that means to you is you would pay that $1,676 again, and you would start your day count all over again. So as you can see, that people don't go into those other day periods, right? Very often. It would usually be a major, accident with multiple operations, or it would be a drug-induced coma or that type of thing. But you can have more than one benefit period in a calendar year, and therefore you could pay that $1,676 more than once. So I'm going to give you an example, which hopefully you'll never do. But if you went in the hospital in January for 10 days and came out, and did it in February, and again in March, and again in April, and again in May, you're still in that same benefit period. You're still working on those 60 days of hospital coverage. If, however, you went into the hospital in January for 10 days and came out and did not go back in until May, more than 60 calendar days have gone between your hospitalizations and when you got out of the hospital, and you would be in a new benefit period, and you would pay that $1,676 again and start on day count 1 again. So that is Part A coverage. Part B, again, is your medical insurance. So while Part A paid for your nursing and your room and board and your meds and that type of thing while you were in the hospital, that was all under Part A. But your surgeons and doctors are not. They're going to fall under Part B. So Part B medical insurance is going to be doctors, labs, x-rays, durable medical equipment, cancer treatments that are outpatient, dialysis. All of those things are going to fall under Part B, including emergency and urgent care. Part B, there is a $185 per month deductible that will come right out of your Social Security check or deposit before you receive it. If you're not yet taking Social Security, you will get a bill for 3 times that amount. You'll get it quarterly, and you can put in an appeal to have it switched to monthly. That may also be income adjusted upward, which I'll show you a chart at the end of the presentation, that where you might pay more than 185. Again, this is per person because you're under Medicare, everything's individual. The first $257 you spend on doctors and labs, etc., would be your responsibility. After that, Medicare is going to pay 80%. You'll pay 20%, unless you go to someone that does not accept assignment. That says they have not agreed to the Medicare rate. They can charge up to 15% above that Medicare rate. If you go to the doctor and say the bill is $200, Medicare rate may only be $100. Of that, if you've already spent your $257 deductible, you would pay $20 of that because Medicare would pay the other $80, unless you went to someone who did not accept assignment. Then you could be responsible for up to another $15 in that example. So what are your out-of-pocket costs for original Medicare? It really depends on the type and frequency of healthcare you need. Whether your doctor accepts assignment, and you can avoid that fee if you go to someone who does accept assignment, and whether you have other health insurance coverage. So what's a Medigap? Medicare Supplement insurance policies are sold by private companies. They have to fulfill the services and the payments that are defined by Medicare, but they are private companies, so the pricing is going to be different per company. They are designed to fill the financial gaps. So they only pay if it's something that Medicare has, a service that Medicare has covered in the first place. But if Medicare has covered it, then your Medigap will cut in, and it can cut in on the deductibles and or the 20% coinsurance. All the Medigap plans are standardized plans. Every plan that has the same letter is going to cover exactly the same services, but the costs will be different. So one of the decisions is whether a Medigap policy is right for you. So a secondary of any type, can lower your out-of-pocket costs. The Medigap policies will have a monthly premium payment, and they only work with original Medicare, Part A and B. But you might not even need a Medigap. If you've got other health insurance as your retiree coverage, it can be an employer retiree plan, it could be FEHB, it could be State of Maryland, TRICARE, VA, Medicaid, COBRA. All of those you would not need a Medigap if you have that kind of secondary coverage. Most people that have worked for any form of government will have something that it acts as their secondary. So to read this chart, if you look down the left-hand side of this chart, those are the coinsurances deductibles that you saw on the earlier chart. These are nationwide numbers. If you go across this chart, those are the plan letters that you can pick. Your two most commonly chosen for people 65 and older would be G and N. A and D are only available to people, are the only plans available to people who are under 65 and disabled. Therefore, their claims tend to be more expensive, and therefore their premiums are more expensive. But if you look at a G, if you look down that column, you will see that there is an X in every row except the Medicare Part B deductible. The Part B deductible, you'll see that nobody is covering that. No plans, if you turned 65 after 1/1 of 2020, you could not pick up a plan that covered the 257. However, a Plan G is going to be your most expensive premium, but it's also going to give you the broadest coverage. Other than that Part B deductible, it's going to pay for all the co-insurances and deductibles you saw in that earlier chart. A plan in is an alternative that is pretty popular as well. Again, it won't pay the $257 Part B deductible, but if you look at the asterisks and look at the bottom of the chart, it looks more like some of your employer coverage, where you might pay a copay up to $20 for a doctor's visit and up to $50 for emergency room if you are not admitted. If you're admitted, you don't pay that. The other difference between a G and an M is if you go to someone who does not accept assignment, your 20% will get covered, but you'd be responsible for that 15%. G high deductible, which is the G with the asterisk next to it, is explained at the bottom of the chart also. And on that, think of that as a catastrophic coverage. In a G high deductible, you're going to have a much lower premium than a G, especially as you age. But you will pay any of the co-insurances or deductibles that you incur in that year up to $28.70 before your policy pays anything. After that, it looks just like a standard plan G. So it's going to cover all the rest of your expense for that year. So let's say you ended up with 2 different hospitalizations that were more than 60 days apart and therefore a new deductible. You would, instead of paying the $1676 twice, you would stop at the $28.70 level. So as you can see, it starts giving you an upper out-of-pocket limit that protects you for the more expensive years. So you might have 5 years that go great that you don't get anywhere near that $28.70, but the year you get there, it can come in very handy. So again, more like catastrophic coverage. So who can buy a Medigap? You have to have parts A and B. They are individual policies. So spouses have to buy separate policies. But as we go through some of this, you'll see that some of the companies do offer household discounts. So you always want to read the footnotes. So medical underwriting. So medical underwriting is a process by when they're going to ask you health questions and they're going to determine your medical history as well as your health status. There is no medical underwriting during your open enrollment period. In that time period, you have guaranteed issue rights. So the guaranteed issue rights, what's important about that is they can ask you no medical questions. And if you want a policy, they have to give it to you. So the best time to buy a Medigap is either the 6 months beginning when you are 65 or older and enrolled in Part B. This is one reason people might delay picking up Part B if they're still actively employed. It can be the first 6 months you are under 65, but also have Plan B, Part B, sorry. So if you were eligible during your open enrollment period as someone who was on disability, then you have a second eligibility period of 6 months where when you turn 65 so that you look like every other 65-year-old. So you get a second chance without medical underwriting to pick up a policy, and then you can pick any plan type. So buying Medigap policies after your personal Medigap open enrollment period, in other words, periods that are guaranteed issue rights for you, you can apply for a Medigap at any time. But the company can require medical underwriting when you're not in your personal Medigap open enrollment. And therefore, you can be turned down or charged more. However, the Maryland legislature did a very nice thing for our residents, one of 5 states the last I looked, that went into effect in the middle of 2023. Used to be when you bought one of these, you wanted to get it during your original 6-month guaranteed issue right period. Excuse me. And if you wanted to change later, you would have been scrutinized by medical underwrite. Now, every year on your birthday, you get a 30-day window starting the day of your birthday, where without medical underwriting, you have the right to shop around and change your Medigap plan. So for this rule to apply, you have to already be enrolled in a Medigap. And you can only change to plans that are equal to or lesser coverage. So you can't pick up a plan that has broader coverage than you had before. So these are the plans you could pick depending on what plan coverage you have. You'll see that if you pick up a plan G, you can switch to almost any other plan type. If you pick up a plan G with a high deductible, you can still shop, but you can only choose, either your own company or another one that's got a plan G with a high deductible. Same thing with an N. If you pick an N, you can only switch to an N. So you have some other time periods that you can have guaranteed issue rights. They're not for 6 months, they're for 63 days. So if you have original Medicare and an employer group health plan that pays after Medicare pays and that plan ends, you get 63 days of guaranteed issue rights. If a Medicare Advantage plan leaves our county, again, you can switch to another Medicare Advantage plan, but you also have the option to go to original Medicare with guaranteed issue rights to apply for a Medigap. If you dropped a Medigap, so let's say when you first came, first came on, you picked a Medicare Advantage plan and you decided that you wanted to join, if you start with a Medigap and you drop it to pick a Medicare Advantage plan, and it's the first time, this is a one-time thing, you decide within that first year that you don't really like that Medicare Advantage plan. You have 63 days to switch back to the Medigap type policy you had. If you joined a Medicare Advantage plan when you first came on at age 65 and you want to switch back to original Medicare, again, if you do it within that first year, then you have the right to 63 days of guaranteed issue right period. There is a book, and you can look it up online as well, as to when you have guaranteed issue rights, and it's on page 22 and 23. But if you follow that link, it'll get you to the book that will give you any other examples. In addition to Medigap plan types, the companies have Medigap policy ratings. So any of the policies can have an across-the-board increase, and those are related to inflation and internal costs. They have to be approved by the Maryland Insurance Administration, but they can be approved for that. But they also are rated, and depending on which plan type you pick, that's going to have an impact. So if you pick an issue age rated plan, then that is based on the age when you purchased it. Your premiums can go up with across the board increases, but not based on age. So if my sister started at 65 and I started at 75, I'm going to always pay more than her because I came in at a later point to that plan. Attained age, which is what most of the ones in our state are, says it's going to go up as you get older. So it can go up two ways. It can go up just because you got older, and secondly, again, across the board increases. Community rated is a different financial model, and the premiums do not depend on age. So for a geographic area, there will be a rate for men and a rate for women. And in order for that to be attractive to the 65-year-old versus the 100-year-old, they give you a deep discount up front. So I'm going to walk you through an example of each of these. So just so you know, this is the listing from the Maryland Insurance Administration site of what you would be quoted for your policies under guaranteed issue rights. For all of these, if you look on the left, there would be the name of the company and how to get in touch with them, both on their website, usually, on their online, as well as calling them. It'll tell you on the right-hand side what type of rating system it is. Most of them in Maryland are attained age. Only two companies, one under your enrollment age and one under the or issue age and one under the community rated. The rest are attained age policies. So I'm just going to walk you across a line just to show you how much can vary. So if you pick up a G and you're a male, you're going to fall under preferred if you're guaranteed issue right period. And you pick up a G, that's going to cost you $228 at age 65. By age 85, that particular plan is going to cost you $406 a month, plus any across the board increases that have occurred. As you can see, the high G is a lot cheaper per month, which is why it's become more popular. And you'll save, a lot up front, 43 versus 228, but you'll save even more by the time you're 85, 83 per month versus 406. And N, you'll see, can be somewhere in between those. So while it's 143 at 65, it's 262 at 85. So this gives you an idea, not only, this tells you how you can get in touch with the company, but gives you an idea of what these plans might cost you. You'll also see, if you look down at the female rates, women are lower costs. They have better health outcomes as they age than men do. This example also shows you, while it shows you all these different plan types, not every company has to offer every plan type. They can choose which plan types they want to offer. So this is an example of the issue age plan. So in issue age, you'll see there still shows 65, 70, 75. For a female non-tobacco guaranteed issue rights, if you look at a plan G, it's going to cost you her 162 at 65. The increases she's going to have to that over the lifetime are not going to be because she aged. It would only be if they have across the board increases. So if a relative went in, a female, at 75, she would start at 249 versus the 162 that the 65-year-old started with. And then again, any across the board increases. This is the only one in the state of Maryland that offers community rated. Community rated, like I said, comes up with one rate for men and one for women. You'll notice, if you look at the base rate, which is what would apply under your guaranteed issue right period, you will see that it looks quite a bit higher than the others you've seen. And again, that's because there's one rate, no dependency on age. This is where it's very important to look at footnotes. So if you enroll within 6 months, in your guaranteed issue right period, when you turn 65, then for those first 3 years, they're going to offer you a 39% discount. If you do the multiplication, that starts putting that pricing of that for you at age 65 right in the range of many of the other plans. They don't then increase your rate because you got older, but they're going to start taking away 3% of that discount. So your premium is going to go up 3% as you keep going forward. All the way, I'm sorry, the discount will go down 3%, the premium will go up 3%, therefore, because they've taken away the discount, portion of it. It's gonna do that every 12 months until you reach 81, and then you're gonna be at whatever that rate is. Again, these can have across the board increases. So 10%, if you look at the bottom, this also tells you that this particular company offers a 10% multi-insured discount for people that live in the same household that have this. The other thing that I will point out is they will also have footnotes that say certain rates can't be used unless you're in a guaranteed issue right period, right? So you'll notice down near the bottom, it talks about the anybody that enrolled later than that, they're going to pay a tier 1 or a tier 2 rate based on their medical underwriting. So it's always important when you're looking at this pricing to understand the different things that it tells you on the page. Make sure you read the footnotes. So how much is a Medigap going to cost you? Again, it's going to depend on a lot of different factors. It'll depend on your age, the company that you buy the policy from, the type of policy you purchase. So is it community rated? Is it attained age? Is it issue age? It's going to depend on your health if you're not in guaranteed issue right period. So, and it'll depend on which letter you pick. So for more information, you want to refer to the Medicare Supplement Policies booklet. You can call us. We can mail that out to you, which is the easiest way for most people to look at this. Or you can go online if you want to. It is an important decision. You want to compare companies and their costs. You want to choose the policy that's best for you. The one for your spouse might not be the best one for you. Then you can contact that insurance company and complete the application. Most people do it right over the phone. And you can buy the Medigap policy. You can also do it online via the plan's website or call the plan. And we're happy to answer any questions for you about Medigap plans, but we don't do the enrollment. This is an enrollment you do. We can help you with the Medicare Advantage enrollment. We can help you with the drug plan enrollment. This is one you do on your own. So again, that's original Medicare, any doctors, any facilities. The Medigap is designed to be that financial safety net. We're now going to talk about Medicare Advantage plans. So again, this will have a network of doctors and facilities, HMO or PPO. HMO, you have no coverage outside that network. PPO, you pay more, but you have coverage. Regionally based. So it's really just an alternative way of getting your Medicare benefits. You're still in the Medicare program. You get all services that are offered under Part A and Part B. You may not be sold a Medigap plan if you have an Advantage plan. So how do these work? They are run by private companies. It's a cost sharing model, which says that you'll have a monthly premium, which might be zero, by the way, and you'll have some co-payment and co-insurance for services. There will be upper out-of-pocket limits. And there will be, meaning that after you reach a certain amount on the medical side, it will give you full coverage of the costs. On the geographic side, that's going to be limited by region, wherever your geography is. So people that spend a significant portion of their time in other states or traveling a lot, this may not be the right answer for them. It does work within a network of providers, and you'll either have no coverage if you pick an HMO, if you go outside that network, or it'll cost you more. It may also require you to get a referral to see a specialist, but they may have extra services that Medicare does not cover, such as vision, dental, and hearing for your standard dental checkup, for your standard eyes checkup and getting glasses. Hearing is one of the ones many of them do an excellent job with. What you want to think through is if you're picking this for this reason, then just make sure that there are doctors or dentists or whatever that are within the network of doctors you want to use or dentist. Prescription drug coverage may be included. So when can you enroll in a Medicare Advantage plan? You can enroll when you're very first eligible for Medicare. You can change your plan and review it every year during the annual open enrollment period, October 15th through December 7th. And you can also do it during special enrollment periods. You should review it every year during the annual enrollment period to see if there's a reason for you to change. These are the plans, Medicare Advantage plans, that are available in Carroll County. These are offered by county. So if you live in Baltimore County, you're going to have some different plans than what you have in Carroll County, because they are even priced by the health metrics of that particular area. So the top ones anybody can choose. The ones below where it says D-SNP Advantage plans, those are only available to people that have Medicare and Medicaid. So this, because the other is a national number, we actually create some charts that show you the different plans that are available to you. The first couple charts are your PPO Advantage plans. And again, those are ones where you'd pay more out of network, but you do have coverage. And the reason we do this is just so you have some starting point for what these would look like compared to the deductibles and coinsurances you do under original Medicare. The pink color is not just to make it colorful. The pink color says there is no prescription drug coverage in that particular plan. These would typically only be chosen by people, for instance, that have VA health benefits, where they have their drug coverage some other way. If you don't have that, you want to pick one that's in the blue on one of these. So just to give you a comparison, under the monthly premium, you'll see that we say HD&T. H stands for a premium associated with the medical or health part. D is the part that's for drugs. And the T just gives you the total monthly premium. We split it out that way because if you're eligible for certain financial assistance, it may only help you against the drug premium, not the health portion of the premium. So those are your monthly premiums. You'll see some of them have a drug deductible, some do not. Most of them do not have a health deductible. The next is your out-of-pocket limit. So in the first one at the Medicare Value Plus, you'll see that you would have to pay coinsurances and deductibles up to $6,750 before they would then cover all your health coverage, not prescription drug, but all of your medical expenses. That's if you stayed totally in network. If you went in and out of network, then you would have to reach the $7,750. You will see as you look down this chart that can vary significantly. So if you go all the way down to the one on the bottom, you'll see that you'd have to reach $8,300 in total in network and $13,300 if you have in and out of network. So let's compare some of the things you would do most regularly. And again, I'm not recommending any of these. This is just giving you the data to have some high-level comparison against the national rates of original Medicare. For all the detail and description, you would go into your Medicare.gov account, and you can pull these up with all the detail and compare them. So if you go to a doctor in the first one on the chart, you'll see you pay for a primary $0 and for a specialist $40. If you go out of network, you're going to pay $10 and then $50 for a specialist. That's unusual for there to only be that much difference conceivably. So, because if you go down later, you'll see how more of them are spelled out. A primary care, for instance, $0, at a specialist $35, and out of network, you're gonna pay 40% on the next to the last one. You'll see, usually you'll see for out of network a percentage number, not a dollar figure. If you go into the hospital, that could cost you more or less than that 1676 you saw under original Medicare. Because on these, there's no benefit periods. Every time you enter the hospital, you start on day count 1 again. And so if you were to go to the hospital, for instance, under the last one on the page, you'll see that would cost you $350 for a day, and that would be $700. However, if you do 5 days in there, you're gonna do 5 times the $350. So that's gonna be more expensive than your 1676. Some of them have 8 days, some of them have 5 days, all different figures in there. So if you say to me, well, which one's gonna cost you less? I can't answer that question. Nobody can, other than you going through and living and putting in your claims. This can tell you what how they're gonna bill it, but we don't know how many times you're gonna be in a hospital, et cetera, right? Skilled nursing facilities tend to look very similar to what you would see over under original Medicare. Outpatient hospital, you can see there'll be a range depending on which plan you pick. One of the things that surprises people that it falls under that, a lot of times you will have a situation where you're doing outpatient joint replacement. You're gonna be under Part B if you are not admitted. So most people these days go in for these things and come out the next day, but some people might spend a night. And they might actually admit you if you have a lot of other conditions they need to watch. So whether it falls under Part B, which is what most of them fall under, or A, if you're actually admitted, you just need to understand how they're admitting you, how they are charging this for you. Okay. This is the back side of the page we were just looking at, just to give you a little more flavor of what you'd spend over here. There's no such thing as in and out of network when you deal with emergency or urgent care. They have to treat you no matter where you are. Okay. This can show you that there's usually a set fee for emergency, but there might be a range under urgent care. Same thing when you get over to diagnostic radiology, MRI. You're going to very often see a range, and then you'll see a percentage for out of network. Many of these diagnostics, you'll have some charge, but yet your standard lab workups in network, you're very often not going to have a charge or a co-insurance for that. You will see a bunch of pages in a row. I'm not going to walk through each of them, but this is your second page of your choices for PPO, which again is what a lot of people, if they pick in Medicare Advantage in Carroll County, they will pick a PPO because they want coverage all the time. The next one, and you just have to look at the headers on these, is an HMO. I will point out to you just so you don't look at it and go, what? You'll notice when you look at the maximum out of pocket, there will be a dollar figure if you stay totally in network. There will be no figure, it's not applicable if you go any of it out of network. That's because, again, you don't have coverage out of network on an HMO. The other thing you'll notice is if you have like outpatient hospital, while it's $325 if you're in network, if you go out of network, again, you're going to pay the full cost. So that's why you see the NAs and the 100%, just so you know how to read the chart. There is a mixed category now that's called HMO POS. We haven't had any feedback on it, but there's supposed to be the opportunity to have certain out-of-network doctors approved and then be considered in network. So you'll see it with Kaiser in particular, but any of them might allow an out-of-network provider to work in their facilities or to handle things that they do not cover, right? With specialists of their own. So it's one you just want to look at more closely. You want to talk to them to see if they have a list of people they've already approved to do that, or whether it's all on one basis. These are the D-SNP programs. This says you're eligible for both Medicare and Medicaid. The three that are listed on the bottom, you actually have to have, it'll tell you what level you need to have to be able to do it. It might require full medical assistance, or QIMBY, which is Medicaid kind of level, or a SLEMBY, which is a little higher than that. So again, this is more to give you the footnotes, give you some comparisons. So let's talk about original Medicare versus Medicare Advantage. This is just sort of the summary of what we've talked about. So on the costs, there's going to be standardized nationwide A and B costs, including your premiums, and then the 20% coinsurance for Medicare covered services after you meet, if you go to a participating provider, after you meet your deductible. On the right-hand side, Medicare Advantage plan, it's going to vary depending on the plan. There's usually a copayment if owed for in-network care, and they may charge you a monthly premium in addition to the Part B premium. Supplemental insurance, so a Medigap. You have the choice to pay an additional premium for a Medigap to cover Medicare cost saving and work as your safety net. You cannot enroll in a Medigap if you are under Medicare Advantage plan. Under providers, you can see any provider and facility that accepts Medicare if you're under original Medicare. If you're under Medicare Advantage plans, you typically can see only in-network providers. Referrals. You don't need a referral for specialists under original Medicare. You very often will need a referral for specialists under Medicare Advantage plans. Under drug coverage, you do have to sign up for a standalone Part D prescription drug plan. In most cases, though, you are going to pick up a Medicare Advantage plan if you do that, that it is inclusive of drug coverage. Under original Medicare, it does not cover vision, hearing, or dental standard services like regular checkups, etc. It's going to pay for something like cataract surgery that's medically necessary. But if you wanted to, do some things like use laser instead of the traditional path, or fix astigmatism at the same time, it's not going to pay for those. You may have coverage for some of that under the Advantage plan, and they can have a premium that they may charge, or other out-of-pocket costs associated with them. We've heard really good things about some of the hearing coverage for like hearing aids and all. So under original Medicare, there is no out-of-pocket limit on your expenditures. You're only got that sort of protection if you've added either a secondary through a retiree plan or a Medigap to pick up those differences. Whereas under the Medicare Advantage plans, you do have an annual out-of-pocket limit, and they pay full cost of your care after you reach the limit. And again, that does not apply to drugs, it applies to the medical side. Under original Medicare, you will get a quarterly Medicare summary notice. And under an Advantage plan, you'll actually get a monthly explanation of benefits. So one of the things you're going to want to do when you first get your Medicare number is to sign up, create an account on Medicare, different from your Social Security account. This is a Medicare.gov account. You'll be able to do a whole lot of things out there. One of the things many people like is, for instance, not only can you view your claims, Medicare claims, and summary notices and all, you can choose to have that all electronic versus getting this paper with you know, the extra pages that tell you what languages you can get it in and all that, right? So some people would prefer to look at it online and not have to shred it later. You can manage your prescription drug list and other personal health information. You can figure out what all the things that are told to you in the About You book, which means you've got at your fingertips what is covered by Medicare, what's not, etc. You can check your health and prescription drug enrollment information, and you can review it on there and change it on there when open enrollment comes around. And you can see where you stand against your Part B deductible. This is the screen that you would greet you with Welcome to Medicare. Once you have a number, you can go down to the left-hand bottom part of the chart there, and you can create an account for yourself. That's also where you would log in. You cannot create it until you have your Medicare number. You can, however, explore the information out there before that. You can say, find health and drug plans. And you can do that without yet having an account, but it's not going to save anything you do. Once you have the account, it's going to save your information. So how do you find out and look at these for Medigap and health plans? Maryland Insurance Administration site, Medicare.gov. The Maryland Insurance site is going to be where you're going to have the monthly supplement information and an easy way to look at the monthly premiums. You can look at them under Medicare.gov, but it's a little more convoluted getting there. What a lot of people would do is call us, and we either send out a book to you or you come in and sit with us and we can do it, or you can call Central Medicare. So this is all about whether you qualify for a Medicare savings program. We do not yet have the 2025 numbers. That's why you see 2024 on this chart. But if you look down the chart on the left-hand side, those would be the different types of savings programs. The first three are federal. The fourth one is a state program. If you, for help on your medical side, if you qualify for Quimby, which means you've met both the income limit test and the asset test, then it's going to pay for most of your expenses. It's going to pay your any Part A and Part B premiums, deductibles, co-insurances, etc. If you'll see it's a little higher number for your income, you might, but the same asset test, you might qualify for SLIMB. That's not going to help you on your co-insurances and deductibles, but it will help pay your, it's going to pay your Part B premium, that $185 a month. If you qualify for Quimby or SLIMB, you automatically qualify for extra help. That is designed to help you on the drug side, the prescription drug side. You'll see it's got a higher income limit and a higher asset test. That is, you would be able to change your plans on that regularly if you qualify for these. The Senior Prescription Drug Assistance Program, the last program on there, has no asset test. And as you can see, the income is significantly higher that you are allowed. If you qualify for that, and if it's a spouse situation, each of you would apply for it separately, although they look at your combined income. And it would pay, if you qualify, up to $75 a month for each of you. So if your premium is $30, it's going to pay $30. If it is $75, it's going to pay $75. It also, if you qualify for this, allows you to change your drug plan once during the year. Otherwise, you pick it at open enrollment and you have it for that year. This can come in handy if you get a new prescription that's not in the formulary of the plan you're on. So these are all helpful to your finances. We can help you look at them and we can help you fill out the applications on these. Just in case there's any confusion about income versus asset, Assets would be if you had a 401 or a 403B or whatever, that's going to be an asset. The income is going to include any form of income, whether that's pension, Social Security. It can be the distribution from a 401k. That would then count as income. So all of that factors in on that side of the equation. Okay, we're going to switch gears now to Senior Medicare Patrol. We are trying to keep this sound, but in fiscal 2024, Medicare reported $54.4 billion in improper payments, and that includes documentation errors, it includes fraud, and abuse. This program is designed to detect, prevent, and report out Medicare fraud. So you are our first line of defense. You need to protect yourself, and that means taking care of your Medicare number. We just had a recent rash where something happened that compromised quite a few Medicare numbers, and they were actually issued a new Medicare number because of it. You know, even if there was not positive, there was a compromised number. So please pay attention. Don't leave your card running around. Don't give it out to even family members, that kind of thing. Medicare will not call you or come to your door to sell you anything. So if someone acts like they're that, you can hang up, you can ignore them, you can whatever you want to do, but don't talk to them. It's not Medicare. So it is some type of scam or fraud. The only people you should be giving your Medicare number out to are your medical providers. And if you call Central Medicare or ourselves for help, we needed to look at that. But there's really nobody else you should be sharing your number with. So the second thing we need you to do is make sure you're reading your explanation of benefits and your Medicare summary notices, because that will tell you everything that has been paid on your behalf by Medicare. So are there services out there you didn't get? Have you billed for something the second go round and you didn't have it done twice? Are you seeing things that were not ordered by your doctor? If you see any of that, then you want to report that suspected fraud and abuse. You're going to start by calling the provider just in case it's a typo or something like that. We're seeing less of that because people are, you know, most offices are now scanning the cards, but, you know, there's still some manual out there. If that is not a fix to the problem, then what you want to do is get the information together, and you can contact your Senior Medicare Patrol, and that would be either Central Medicare, or you can come to us and we can help you figure out if something needs to be filed. But if you've contacted Medicare about it, you don't also need to contact us. They will run with it once you've contacted them on that. It is free and confidential. So again, I represent both SHIP and SMP office. You'll see at the bottom, Kristen Harvey's number. She is the one full-time employee for Carroll County that works with Medicare. She's the program coordinator. You can get her by phone or by email. Please do not do repetitive calls into her. Some people will call 2 and 3 times a day and leave multiple messages. That just delays her getting back to you, because she's got to listen to every one of those to see what's what. So please be patient. She gets a lot of phone calls and a lot of emails. So, but she will definitely be helping you out. She sets up all our appointments for the volunteers as well as for herself. So I mentioned earlier income adjustment, a monthly income adjustment. So if you're above certain income levels, and that's gross income, it's something called MAGI, which is actually your adjusted gross income plus things that have been put aside that you didn't have to pay, like tax exempt interest and parts of your Social Security that you might not have paid taxes on. So if you fall into these categories, and you should talk to a tax accountant, can help you with this, then your your payment for your Part B, as you can see, could go anywhere per person from $185 all the way up to $629. It is based on income from your federal income tax from 2 years ago. And if you have made a change, like you have retired in that cycle, and therefore your income is significantly different, you can put in an appeal to not have to pay that IRMA. So you would want to do that. There's also an adjustment under the Part D prescription drug plan. That would be your plan premium that you're paying plus the number you see on the right-hand side here. So again, this is just to make you aware so you don't go into retirement and all of a sudden say, what just happened? We just like you to be aware of it. We appreciate you attending. Again, my name is Lois, and we do get some support for publishing the things we publish and all through the federal government. So if you'd like to fill out this survey, we would appreciate it. And if not, we appreciate you joining us today. Thank you. That's the end.